So I'm going to give you a little idea of what we do as respiratory therapists when we're going into a patient's room to assess their breath sounds and kind of their overall respiratory status. We're going to be talking about breath sounds. Now, this is one of the absolute keys to assessment. And if you've been working clinically at all, you'll know that across all disciplines, everybody does them a little bit different. Today's video, I'm going to show you how to assess breath sounds like a respiratory therapist. You ready? Let's go. One of the most objective things in the assessment is breath sounds. Today I want to break them down, try to make it somewhat easy so that you can assess your patients accurately and the same way each time. And that's really key.